Today we're going to be covering the endocrine system. I'm in your anatomy book, chapter 12, which starts on page 318. So let's jump in. We have a lot to digest in this chapter. There's a lot going on with the endocrine system. So we're just going to take this a chunk at a time and work our way through it. And you will have a much greater understanding when we get done. Past all this. So the endocrine system, and I have it highlighted here on the screen, it works a lot like the nervous system, communication and control. The difference between the nervous system and the endocrine system is the speed at which it works. The nervous system works incredibly fast. And you know this if you've ever stepped on anything that was pokey, glass or a picker out in the yard, that sensation picked up by your toes travels to your brain and back to your foot and makes you pull your foot off of whatever was hurting it. And that's an incredibly fast response. The nervous system works much slower. It works by putting hormones, which is a chemical, into the body, and it's typically circulated through the blood to make something happen. And so that's not going to happen lightning fast like your nervous system does, but it can have long-term effect on our body, and it does control many of the functions that our body is carrying out. So when we talk about other body systems, let's say the digestive system, all the pieces and parts are touching each other. We go from our mouth to our esophagus to our stomach to our intestines, and the system is all touching each other. That is not the case here with the endocrine system, and you have organs spread throughout your body. So we have three of them located up here in the head: the hypothalamus, the pituitary gland, and the pineal gland. Okay. Then we have some that are located in our neck, the thyroid and the parathyroid, and you can see the parathyroid's actually sitting right on top of the thyroid, like 4 little dots. So they're connected. The thymus we actually call as being located in the mediastinum, right in the middle between our lungs, right behind the rib cage, behind the sternum. The adrenals sit there like 2 little hats sitting right on top of the kidneys. So you've got 2 adrenals because they sit on top of your 2 kidneys. The pancreas is also there in your belly. And then in the lower, men have testicles, women have ovaries. And the testicles and the ovaries perform very similar functions between the man and the woman, obviously with some differences, but their whole purpose is the reproductive part of our systems, depending on which gender. Okay, so the first key is for you to understand what the organs are and where are they located. Okay, so that's number 1 that you need to learn. Endocrine glands and exocrine glands. Using our med term, endo means within, exo means out, outer, outside, all of those kinds of things. And you could think of like your ex-boyfriend, your ex-girlfriend. They're out of here, okay? Ex means out. And so an exocrine gland, something to do with out. I mean, that's what ex means. And endo somehow means within, right? Okay. So now let's build on those definitions. An exocrine gland secretes what they're putting out. Oops, come on, highlighter. There we go. Into a duct. So through a tube of some kind, into a surface or a cavity. So think of your sweat gland. That's an exocrine gland. And so you sweat, and it comes out through the ducts. There we go. Through the ducts in our skin to the sweat that we can see and feel. Okay. There's your gallbladder is also exocrine, where it takes the bile and it squirts it into the digestive system through a duct, okay? Endocrine, however, do not work through a duct system. They are ductless. They secrete it into the intracellular space. So let's say I'm the thyroid. I'm just going to put out my hormone right here, right around me. And then the body will then get that into the bloodstream. Okay, so no ducts, no tubes. Okay. Endocrine, when a gland puts out its hormone, it is to accomplish a certain function. So if the pancreas is putting out insulin, it wants to decrease your sugar level in your blood. So that is the purpose of the insulin that the pancreas puts out. It has no other purpose in the body. So when that hormone makes it into the bloodstream, it is looking for its target. What is it I am looking for to be able to accomplish what it is I am here to do? So when it comes into contact with calcium in your blood, it doesn't care. When it finds the salt in your blood, it doesn't care. All it's looking for is the sugar. Okay? It's the only purpose. Okay? So sometimes hormones are sent to activate another hormone. For example, the luteinizing hormone in my pituitary gland, which is in my head, the whole job of the luteinizing hormone is to talk to the ovary. So when that hormone gets released into my bloodstream, it's looking for an organ, the ovary. And so it's got to find that exact organ to deliver its message. And so we're going to talk about those before we get into the actual hormones. Steroids and non-steroid hormones. Okay, those are the two classes, and they differ based on how do they influence the target that they're looking for. Okay, a non-steroid hormone works according to what's called the second messenger mechanism. This is the example that I just gave you about the luteinizing hormone, whose job it is to talk to the ovary. So it is a messenger to tell another organ to do something with another hormone. And that's what that messenger system is that the luteinizing hormone, when it's released from my brain, doesn't actually do anything other than deliver a message. So think of it as the mailman. Okay? It's delivering a message. It's not carrying out any other activity. Okay? And the way that it works is like a key going into a lock. So when that luteinizing hormone is circulating in my bloodstream, with every pump of my heart, that blood goes in different directions. Some of the blood goes to my fingers, some of the blood goes to my toes, all the other organs in my body. So it's circulating looking for the ovary. And when it finds it, it can deliver the message. So how does it know when it found it? And that's this key into a lock. It has a certain shape. It's a protein. It has a certain shape. And when it finds the ovary, it's like a key fitting into the lock. It's the only organ that that key fits into. And so it knows when it found the right place. Okay. So in summary, non-steroid serves as the messenger, providing a communication between the endocrine gland where it originated and the target organ. And then it provides communication to the target and says, ovulate, or grow, or whatever else the message is, depending on what the purpose of that hormone is. Okay. Here's kind of a picture of that lock and key where I was describing it. So see how this one uses round. and it's the only thing that's going to fit into there. Here's another example of a shape. And as soon as it finds its destination, it is able to get in there and deliver its message. Steroid hormones do not work by the second messenger. These ones can actually go right into the target cell itself. It does not need someone else to deliver a message. It can find where it's going, and it can create the reaction in the body that we're looking for all by itself. So these ones are also steroid, or these ones are the steroid, and these ones are, I believe, are also proteins. I don't see that on there, but I believe they're all proteins. Okay. All right. So if you were here in Module 1, we've talked about the negative feedback loop in the body, but not everybody was here. So let's revisit this topic as to what is this negative feedback loop. So our body likes the condition called homeostasis. Homeostasis means that our body has a level of what we like to be normal. Whether that's our blood sugar, our calcium level, our salt level, our body temperature, whatever it is, we like it normal. And when we get out of normal, our body doesn't like it. That means we're out of homeostasis, and our body wants to do something to bring it back to normal. And that's what the negative feedback loop is. We are seeing something out of normal, and we're changing something to bring us back to normal. So when our body gets too hot, what does our body do to release heat? We sweat. That is a negative feedback response by our body to counter the heat. So if you're out gardening, working in the hot sun, mowing the lawn, jogging, whatever outside, you get too hot, you will start sweating, and that's your body's response. Well, to use hormones as an example, when you decide instead of dinner, you're going to have an ice cream sundae instead, and that's your dinner, and you intake a lot of sugar into your body, your blood sugar goes up. That's not okay with us. Our bodies don't like that. We are out of homeostasis. So our pancreas releases insulin to bring our blood sugar back down. And that's like the same example of sweating to bring your temperature back down. So negative feedback loop means that we are reversing the direction of the disturbance of the body, and we are bringing it back into homeostasis. Okay? That's why our hormones, some of them, are there, okay, is to regulate certain things. Positive feedback is when our body is out of homeostasis, and instead of wanting to stop it, our body wants to encourage it to continue. Using a hormone example, there's only a couple of positive feedback examples in your body anyway, but using a hormone example, a woman going into labor to have a baby is not normal. That's not homeostasis, but our body likes it. It says it's time, we need to do this. And so rather than the negative feedback trying to stop it, we're going to have positive feedback to ask it to continue. Get stronger. Let's have this baby. Okay. If we didn't have any of these things, our bodies would be all over the place, and too much vitamins and minerals and too little vitamins and minerals can really mess up our internal environment. And so without this negative feedback loop, we couldn't sustain life. We're just going to hit some basic terms here. Too much of a hormone is hyper secretion, and too little of a hormone is hypo secretion. So too much, too little. Because if we're not putting out the right levels of hormones, that can cause a disease as well inside our body. Endocrinologist is a doctor who studies the hormones. A lot of patients who are diabetic see endocrinologists regularly for monitoring. And then, of course, endocrinology, the study of hormones. Which further we got? Okay, this is the last section. Okay, prostaglandin. A prostaglandin is also called a tissue hormone. And this works a little bit different than the other hormones in our body. This one is found a lot of times in our muscle tissue, and by being called a tissue hormone, it means that when it puts out its thing, it doesn't go very far. This one doesn't usually go into the bloodstream. It kind of stays right there. And some of the most common examples here are prostaglandin A, E, and F. They have a lot to do with regulating weight and some other things like that. But they don't go very far. So just kind of know the concept of a prostaglandin being a tissue gland, and its reaction is very, very local. Okay. I'm going to stop video number 1 here because we're about to get into the organs and the hormones, and so it's a great transitional place into starting video number 2. So continue on. I'm going to give you tips on how to study this, how to learn it, because we have a number of hormones that we're going to be going through.